All right. Okay, so it's recording. Uh, I can start sharing the screen, and you can all see that, right? Yes? Okay, cool. All right. Okay, so this is our healthcare organization teams during the COVID-19 proposal presentation. My name's Jackie. I'm a third year medical student.
My name's Keegan and I'm in OT school.
My name's John, and I'm a third year of PT school.
Hi, my name's Anila. I'm a third year med student.
Hi, my name is Isabel, and I am in my second year of the Accelerated Master of Nursing program.
I'm Robert. I'm a third year medical student.
I'm Veronica, and I'm in my final year of PT school.
All right, so we'll get started with our presentation here.
Okay, so radical belonging is a social, academic, and democratic vision for anti-racist communities and relationships between them. And this particularly focuses on students of color. And radical belonging ensures that there is solidarity among those from diverse backgrounds, roles, and social identities.
Jackie, you skipped a slide.
Oh, I'm sorry.
There's been an inequitable impact of COVID-19 on the pandemic in general, but this slide is really particularly on healthcare and healthcare workers. For one, there's been a significant pipeline disruption. In this paper in the Lancet, over 80K student nurses were not admitted because they had to cut back on clinical space, and half of the report of the questioned MD schools reported limiting capacity during COVID. There's an increasing amount of healthcare workers leaving. Some surveys report up to about 18% of pre-COVID healthcare workers have left the field, and then about 12% of the pre-COVID healthcare workforce has been laid off or redistributed in maybe ways they didn't want to. And then another big one is worker burnout. And per this other paper I found in the Lancet, at a large academic institution, residents and fellows, about 33% reported to be emotionally exhausted, and about half of those residents also reported feelings consistent with burnout. So it's like a very prevalent feeling, and kind of this feeling of being overwhelmed in healthcare. That's definitely partially the result of COVID.
So as a group, when we met earlier, we kind of came up with some recommendations at the individual, team, and organizational levels. So the first thing that we thought about was to kind of create this multidisciplinary committee, which takes people from multiple different professions in the hospital. And this committee would be responsible for overseeing concerns that could be submitted online via either a hospital employee site or even maybe like a medical documentation system like Epic. The point of this is to just have concerns be reported appropriately. And also the big change that we were interested in was making sure that people who do submit complaints get some sort of feedback. Something I've heard really often from attendings at St. Mary's is that they submit concerns about things that happened in the OR, but they never really hear back about how the problem was addressed. And I think it's also really important that students from all professions have access to this, because sometimes we do see things happening in the hospital that aren't necessarily reportable to our school, but I feel like should be reportable to the hospital system. Another action that we thought would support the hospital was to increase the nurse floor staffing to prevent high workload and burnout. Something that I learned from our home nurses or our nursing students here is that there has been an increase in the amount of travel nurses in the hospital, and sometimes when those nurses leave, it creates an increased workload on the nurses that are left behind. So we just want to make sure that nurses have enough staffing so that they can manage all the patients on the floor. Another point brought up by our PT and OT students was to advocate for new equipment in the hospital gym and rehab centers. We thought it would be a good idea to use storage space on the floors for easier equipment access, because sometimes they can be lugging around all their equipment around the hospital. And PT and OT is a resource that the hospital heavily relies on for patients to get better. And then lastly, we thought it would be a good idea to have annual check-ins for all employees with human resources. Of course, employees can opt out of it if they don't want to meet with human resources, but the goal is to identify burnout early and provide resources so that our employees feel supported.
So we looked a little bit deeper into the potential impacts of each of these proposals on clinician well-being, as well as outcomes in patient care. So we broke it down into the 4 proposals. For multidisciplinary employee committee, this proposal offers multiple perspectives for achieving resolutions and allows providers to feel that their individual opinions are valued. It also implements a psychologically safe environment for clinicians to openly discuss vulnerability, stress, burnout, and any other barriers to their well-being. And also facilitates mechanisms for cooperation and collaboration between management, different clinical teams, and various clinicians as well. Our proposal to increase the amount of more permanent staffing as well was aimed to decrease burnout, which leads to improved patient outcomes, as well as increased patient satisfaction with their providers. Also allowing for increased flexibility in cases of illness, especially in light of the COVID-19 pandemic, and just general personal absences. And as increased staff across the board can decrease some of the individual pressures and workload on each nurse or staff. Our next point was for increases in equipment accessibility, specifically for our PT/OT teams. In this case, it improves efficiency. We're hoping to increase both the speed and the range of care and therapy that can be delivered to patients. And this in turn should improve outcomes as well as patient satisfaction, not having to wait as long or having therapies that are more tailored to what they need. And lastly, the check-ins, the optional check-ins with HR, we're emphasizing reflection and self-care to hopefully promote resilience, improve the work environment, and better emphasize the importance of self-care. Other than that, clinicians that feel supported are generally going to be better equipped to ensure both their personal safety and that of the safety of their patients. And in general, just the focus is on honoring the rights of clinicians and making them feel heard, so that they're less likely to experience burnout.
Okay, so how do these interventions address stresses of healthcare members with marginalized identities? So we took some facts from the disparate impact of the COVID-19 pandemic and health equity data gaps article. We found that compared with white individuals, COVID-19 mortality rates were 3.8 times higher among Black individuals. And Black communities, even before COVID-19, were more likely to have high rates of underlying health conditions, lower levels of health insurance, and more individuals working frontline jobs, therefore putting individuals in these communities at elevated risk for infection and poor health outcomes. We also found that Hispanic communities had the greatest number of COVID-19 related deaths among all racial and ethnic minority groups. And Asian American, Native Hawaiian, and Pacific Islander residents have reported significantly higher rates of COVID-19 positive cases than any other racial and ethnic groups. And the FBI documented a 77% increase in hate crimes against Asian American people from 2019 to 2020. So it's clear that the marginalized populations have experienced a tremendous amount of hardship from COVID-19. So let me go to the next slide. So how do these interventions help the stresses of healthcare members with marginalized identities? So one of the things we said we were going to do was the multidisciplinary employee committee. This will ensure that all healthcare workers' voices are heard. This shows that It's a good way for the marginalized identity healthcare workers to get their voices heard, and to make sure something comes of their comments or complaints. And then the other thing we wanted to do was more access to PT and OT equipment. And some of these areas are often underserved and don't receive priority funding for new technology or adequate equipment. So having adequate equipment is the first step to decrease the stress of healthcare workers so they can better provide care during COVID-19. And then the last thing we were going to do was increase nurse floor staffing and have more frequent check-ins with HR. It's important for marginalized healthcare workers because statistically speaking, minority and marginalized healthcare workers are under more stress from a variety of factors such as racism, sexism, and increased stress from COVID-19 hardships. Increased staff and check-ins with HR will promote better care as healthcare workers will have more time with each patient and feel supported by their employer.
All right, so in order to implement all of these things, such as a multidisciplinary employee committee or having annual check-ins, it is necessary to have reliable communication between disciplines. So utilizing modes of communication such as team meetings, gatherings, through email, weekly meetings, or a discussion board are all ways in which individuals can start learning from each other. Receiving feedback is also really important because by receiving feedback, you're having improving feelings of belonging, while also feeling acknowledged that your feedback is being received and being implemented. Another important step is to build a culture. So in the COVID pandemic, with a high amount of stress and burnout that individuals are experiencing, it is necessary to establish a culture of resilience, teamwork, friendliness, and cooperation. Establishing team building exercises or recreational activities can also go a long way in building relationships between fellow coworkers in order to decrease burnout and encourage enthusiasm for working. In addition, providing resources, whether through coworkers or through the HR, is important for managing your own well-being too. And so interprofessional team communication plays a pretty important role in implementing this stuff, because by utilizing interprofessional team communication, you can discuss your own viewpoints as well as things that you may want to be implemented. It also encourages patient-centered care, improve working relationships, and will save time, but by distributing the work across multiple departments while keeping individuals on the same page.
When implementing the multidisciplinary team and the well-being steps that they're taking, it's important to also have metrics and measures of the success of this team. One way to do this is with biannual feedback surveys. Sending out biannual feedback surveys to all multidisciplinary team members can ensure that metrics are being implemented appropriately. Another way besides email is posting scannable QR codes across the floors, so that these healthcare workers are able to just scan the QR code and take the survey when it's posted. Another way to measure the success is compliance audits. Having a compliance audit for each interprofessional team that reports back to the board. So having a nurse audit the appropriate nursing staff on each floor and then reporting back to that multidisciplinary team, as well as having PT and OT audits, auditing the equipment access on each floor. And then you also need to make sure that the measures being implemented are sustainable. And another way to do this is to have an annual multidisciplinary board election. Keeping the members on the board current can assist with new ideas and sustain the movement towards belongingness between these teams. Another way to ensure sustainability is to have achievable goals, and setting these achievable goals that the board can work towards and then mark when they're done. And then celebrating the success of the program when these goals are met, and then also setting new goals to keep the program moving forward can assist with the sustainability.
And those are our references. Thank you. So in our last few minutes, we just wanted to take a bit of time to talk about what each of us in the team individually learned throughout the process of talking about these proposals and also in putting together our slides. So we'll kind of just go around and share a few words.
Okay, throughout this IPTS presentation, it was really great to work with team members from other healthcare fields, and Working with them, you really learn their perspective and what they see, but how all together are working towards one common goal.
Yeah, I think one important thing that I learned and what we kind of mentioned was this idea of setting, not only setting goals, but also like having these initiatives or like metrics. So in our example, we had the like feedback surveys and then a compliance audit and then like the follow up with HR kind of thing. So really keeping us accountable. It's easier to just post something, but like following through is like where really a lot of the effect comes through. So I think that was an important thing that we discussed and that we learned.
Yeah, and I agree with everything that Robert and Isabel said. I also feel like it was really cool working with students from other professions, since we don't generally get a lot of experience working with, or at least as a med student, I don't really see any other students that are not med students. So this was a really cool perspective. And I think it's also nice to kind of have this practice about how to come up with I guess, plans, organizational plans for how to deal with conflicts in the hospital. I think that's good practice for our careers in the future. And I feel like this is something that I can maybe apply to my career a few years down the road.
Yeah, so I learned a lot about being open-minded and having good communication skills, and even just like hearing other people's ideas, being open to what everyone on your team has to say, and being an OT student. I feel like mainly I only like interact with like OT or PT or AT students or speech. So it was really nice to hear like different perspectives from like the med students and nursing students in our group as well.
I agree with that. And I think one of my biggest takeaways is keeping an open mind in the future when it comes to different healthcare providers. Even just in our assignments that we did in those like case 1 and 2, I sort of realized that if we weren't um, actively considering what another team might feel was a priority or a goal for the patients, that it would have never occurred to me, and thus I think those um, scenario patients wouldn't have gotten as much um, well-rounded care as they could have if we included everyone, took everyone's point of view into perspective. And when we got to this proposal project, then I think we all kind of were trying to think outside the box and consider what healthcare personnel like across the board would want in implementing hospital-wide protocol like proposals. So um, mostly it was that, like, and of course, I really enjoyed working with all of you as well.
Yeah. So one thing I learned about was that first, I just really liked the experience of working with other students because, hearing about all of their different viewpoints and the things that they can contribute to the conversation is all really interesting. I haven't really worked with a lot of other students from different, like fields than just like other PT students. So it was also interesting to hear, how different we are, but also how we can work together for one common goal. And so when we're working on like our, PowerPoint and presentation, we all had different things to say and different like roles that we can contribute to come together for, one common thing.
One big thing I learned through doing this project and presentation, and then with the cases in the past, was the importance of communication. Good communication can help prevent a lot of errors in the hospital. And I haven't had my acute clinicals yet, so it was kind of cool listening to your guys' recommendations and stuff, because most of you, I think, have been out in the hospital by now. And learning about the marginalized healthcare workers, especially, like, is terrible, obviously, but having to deal with so many other hardships would definitely make it hard to do work. And then I took away the importance of advocating for our fellow healthcare workers in the future. We're all going to be working together in the future, so it will be important to stick up for each other, so we can have good working conditions and good care for our patients.
Right. Well, that's all we had to say. So thanks for watching.
Thank you.